11 things that a little bit of excess weight can really harm your ED. Stay tuned to find out. Do you know that there are 11 bad conditions that caused by obesity that affect your ED? Obesity is a major risk factor for erectile dysfunction. Men who are overweight or who are obese are more likely to experience ED than those who are healthy. The risk of ED increasing with increasing body mass index. Let me tell you why. There are several mechanisms by which obesity can lead to ED. These include number one, first, excess weight can actually lead to diabetes. What that means is that it's the development of diabetes, which then lead to a more increasing risk of ED because diabetes can increase the risk of ED by sixfold. Excess weight can also cause high blood pressure. Excess weight can also cause high cholesterol. And obesity can also damage blood vessels, the endothelium, which is that lining inside the blood vessel, making it more difficult for blood to flow to the penis. Again, when you have excess fat, which then build up around the artery, which is inside the opening of the artery to where your blood flow, it becomes narrow and it's harder for blood to go through. And that condition is called atherosclerosis. And then another thing that ED can cause is low testosterone. Low testosterone can contribute to ED as well. And testosterone is what makes you a male. And so it plays a critical part in sexual function. Obesity can also cause inflammation of the organs and the blood vessels as well. Obesity can also contribute to anxiety and depression, and also heart disease. Like, for instance, the arteries of the heart become narrow, atherosclerotic disease. It can also cause strokes. It can also cause sleep apnea, and particularly cancer. What most worrisome is colon, kidney, liver, thyroid, pancreatic cancer, meningioma, which is the brain cancer itself. So obesity, let's go define this a little bit clearer. Obesity is defined as the BMI of 30 or higher. A BMI is a measure of body fat based on height and weight. And a BMI of 18.5 to 24.9 is considered healthy. So essentially from 18 to 25. And from 25 to 30 is considered overweight. And 30 or higher is considered obese. I'm in the overweight range, actually, according to my height. So there are different categories of obesity depending on the BMI. Like class 1 obesity is the BMI of 30 to 35, class 2 obesity, BMI of 35 to 40, and class 3 obesity or severe obesity is BMI of 40 or higher. So how do you calculate BMI, right? If you're interested in like knowing what your BMI is, you can actually go on any Google it. Well, BMI means that your weight in kilograms divided by your height in meters square. So kg over your height in meters square, and that's how you can calculate your BMI, or you can just Google it and put in your weight and your height. And so, having said that, losing weight can really help improve ED in men who are overweight or even in the obese range. In one study, men who lost an average of 10% of their body weight actually significantly improved their ED symptoms. So just 10%, let's say you weigh 200 pounds, and if you lose 10% of your body weight, which is 20 pounds, your ED can improve, and probably your blood work will improve, particularly your blood sugar, and your blood pressure will improve as well as your cholesterol. I have seen a lot of my patients essentially just cut down carb, but essentially they just don't eat bread every day, they don't drink soda every day, or eat pastries every day. Just doing minor changes in their diet actually increase their testosterone level twofold, as well as lowering their cholesterol and they see an improvement in their erection and also their morning wood as well. So you'll be amazed, just a little of change in your weight will really affect your erection. So consider that. I've always talked about and advocate the Mediterranean diet, which is a diet that is recommended for diabetes as well as for heart disease. Now, ED parallel heart disease, right? Because the artery to the penis is the smallest artery in the body at 1 to 2 millimeter, about the size of an ant. And the arteries in the heart is about 4 millimeter, 5 millimeter, so twice as much. So if you have ED, it's almost like you have a penis attack, like a heart attack. So you got to be really take your ED seriously. Now, would you have chest pain and then ignore that? Or would you want to go to the doctor and get your blood work and get evaluated? Because we are taught that if you have chest pain, go to ER and get evaluated. Well, my thinking that if you have ED, you need to evaluate what's going on first, get your blood work done, right? Look at your diet, look at your lifestyle, and see if you're smoking, maybe how much alcohol you're drinking, what type of diet are you on, are you exercising? The four main critical area. Start with that first. Don't just take a pill and ignore the lifestyle changes or modification that later on may save your life, prevent you from having a stroke or prevent you from having a heart attack. And I just listed to you 11 risk factors that obesity can cause, even lead to even colon cancer as well. So a little bit goes a long way. And I hope that you liked it and find this helpful. I would appreciate it if you can subscribe, comment, and let me know how you like this episode. You have any questions. See you in the next episode. Thank you. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board-certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instruction to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart-related problems such as strokes and heart attack. Number 3, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.